Hi, everyone. It looks like we're live now. We're going to give folks just a couple minutes to filter into the virtual room here. Today's webinar is Automation and AI to Solve Business Problems in Medical Communications. This is part one of the two-part series. Part two will be on June 11th, and we invite you to join us then as well. We'll give folks just a minute or two to join, and then we'll go ahead and get started. I see a couple of AI enthusiasts have filtered in already. So it looks like we're gaining a good crew here. We'll be excited to get started in just a few minutes. And we'll probably just give folks another 30 seconds or so to join us. The session is recording, just for everybody's information. And we're in Automation and AI to Solve Business Problems in Medical Communications, part one of our two-part series. And with that, we're a couple minutes past, so I think we'll go ahead and get started. We're hoping to send out the recording afterwards for anybody who misses the first couple of minutes. So I am Jeanette Towles. I'm the founder and CEO of Synterex. And I'm joined today by my co-host, Pushpa, who I'm going to throw over to in a second to introduce herself. But before we do that, we wanted to have a little fun activity at the beginning. And so we're going to go through for each of the hosts and panelists. When did we first start using AI and when did we most recently use it? So for myself, I believe I started using some combination of automation and AI probably in 2014 or so. So that was quite some time ago. And I've learned a lot ever since then. It evolves. And when did I last use it? Was probably late last week. I was working on some questions for a panel I'm going to be doing at a conference, and I wanted to brainstorm some questions for my panel. So I, put in some prompts to go back and forth on that and got a couple of really good questions out of it. And it also prompted me to think of a couple more. So it was a really great activity. And Pushpa?
First of all, thanks for inviting me. Great to be here. And first time I used was when I was coming up with like spelling words for my 9-year-old daughter, and I wanted to check out ChatGPT, and it spitted out such beautiful words for a 9-year-old for spelling test. So that's on the personal end, and then also to from there to just even like planning my summer vacation. It just gave me an itinerary of like 5 days in London, beautiful itinerary in 10 seconds, right? So that's on the personal side. But on for our business, we use it heavily on communications on almost like a daily basis. And also we support as a technical integration so that our customers can use it as well.
Awesome. Great examples. And we're joined today by our guest speakers, Alex Olinger from Synterex IT and Kevin Chen, our medical writing consultant. So Alex, how about you?
In like 2016, I took a class for AI development when I was studying computer science, and so we used it then, and then probably about 10 minutes ago to help me with an email. So, yeah.
And Kevin?
Yeah, I'd say like really rudimentary version of AI in like 2010 because I was trying to play a video game online and it was a dead video game. No one played it anymore. But they had this kind of like open source way to make robots play with you, and I was trying to get it to work and it didn't really work. So yeah, that really simple version of it.
Nice. Well, I think that goes to show you that we can use this in both business and personal contexts and save ourselves some time. So that's a great transition into what we're going to talk about today. So As we all know, as generative AI kind of burst onto the scene in the 2019 to 2021 timeframe, folks seem to really have a range of reactions to that, from excitement about its applicability and opportunities it could bring, to fear over how it could impact jobs or what the impacts of bias and lack of regulation could bring. Even today, this range of emotions to a single thing in the world somehow seems entirely appropriate. Now, Alex and Kevin, you guys have been out at conferences recently, and how is the temperature in the room on these topics nowadays? Is there still this mixed emotion, and what types of concerns or comments are you hearing about?
Yeah, I've only been to one small DIA conference last March, and it was focused on the med affairs and medical writing fields. In these fields, I'm not sure there's much apprehension left, because speakers have been reiterating for a long time that people simply just need to learn about and work with technology in order to maintain control over what that technology does, and to maintain job security. So at DIA, not a single speaker harped on these sentiments. All of the discussion were focused on demonstrating or theory crafting practical applications of AI.
Interesting. Alex, how about you?
Yeah, so I've been to 3 conferences so far this year, 2 around medical writing and 1 was from Microsoft. On the medical writing side, it seems the manager side of house is more excited due to the potential of shortening project timelines, and writers are more skeptical about around job loss. To note that AI is a long way away from fully replacing writers, even if governing bodies allowed it in the medical space. But on the Microsoft side, they won't stop talking about it. This year, Microsoft invested $12 billion into AI for just Q1, all around Copilot, which is their AI tool.
Interesting. Again, seeing such a range of emotions. Pushpa, is this kind of what you've seen as well in your space?
Yeah, I will give a little bit different perspective. So we are a tech vendor, so we work very closely with the communications, market communications, brand teams, and then also very closely with IT. So given life sciences is a highly regulated market, it's not very easy for IT to take the decision on just use AI or not use AI, because we are talking about individual companies, not as just an industry. Yes, industry, everybody wants to use technology, but we have seen both ways. So companies, either they are completely want to be away from AI, not because they do not want to use the technology, but because they're not ready with their internal guidelines on how to use it. Especially some of these content can be very sensitive and then should not be used to train other models. So they're very, very skeptical about using this and then opening it up to, first of all employees. Some companies are opening it up to only a few departments and then also with training. And otherwise, some companies are pretty open. Again, the risk also lies in agencies that are even outside the company that are actually working on the content. So there's a lot of these things. So IT teams have been very cautious in what they are ready to use, let the employees use or not. So, but what do you think is how do we really help in the business, right, Jeanette? So that's the question. What do you think, right?
Absolutely. I think it's a really great question. And, for me, it's about balancing a couple of things. So really, when we look at this, it's about risk versus value. And you kind of have to get a holistic view and take a look at both. So let's start by taking a look at the risk piece. So there's a range of different policies and guidelines that have come out on this topic, but let's hit on some key ones that were either foundational and sort of summarized or some subsumed different thoughts on responsible AI and risk evaluation. So firstly, the Center for AI and Digital Policy introduced the Universal Guidelines, or UGAI, which is what you see scrolling on the screen right now. That was in 2018 at the International Data Protection and Privacy Commissioners Conference. Now, this particular entity is a global nonprofit organization really focused on making sure that digital policy aligns with human rights and democratic values. So as a nonprofit, their guidelines are not legally binding. But fast forward to 2019, and a lot of these concepts were adopted under the Organization for Economic Cooperation and Development, or OECD, principles on AI, which are international intergovernmental policies that are adopted and upheld at the level of participating countries, which was at the time 42. And it was also endorsed by the G20 as well. So we're going to pause there before we go into a deeper dive on the policy making part of it and do a quick poll. So you're going to see a poll pop up on your screen, and you can go ahead and answer that. So are you currently using AI and automation tools in your medical writing or communication business? And the possible responses are yes, no, but considering it, and no, but not interested. So we'll give folks a minute to go ahead and answer that and get their responses submitted. And we're seeing some great responses so far to this. And they're still coming in, so we'll give folks another second here. So overall, it looks like about 75% of the attendees or respondees are using automation and AI in their business currently, and 25% are not, but are considering it. So that's great news. You're in the right place today to talk about how we can do that. So let's hop back into policy making. So over the next couple of years between 2018 and present, across the globe, we saw some different jurisdictional and other organizational groups weighing in on positions on AI, from the WHO commenting on policy specific to healthcare, to individual countries trying to reconcile the concepts to their laws in the country and also their country level policy. In March of 2024, the UN made a resolution as led by the US, which many of the member states either co-sponsored or backed, outlining a path forward for the responsible use of AI. And it included the concept of human centricity, security, and trustworthiness. Interestingly, the UN, in no uncertain terms, reiterated its position that AI could still be a long-term way to help them meet and accelerate their goals, called the Sustainable Development Goals. Even just this month, there was an adoption of a formal treaty on AI in the EU, and guidelines on AI as relates to the protection of elections that went from the US Senate committee to the Senate floor for voting. So panelists, looking at this, why do you think so many different groups had to weigh in on these guidelines? And frankly, what do you think is taking them so long to get to the bottom of? Alex?
So AI impacts every aspect of society, from healthcare and education to security and economy. It doesn't surprise me that it's taking so long, given all sides of the government, of every government, must weigh in. Given that AI in general is cutting edge, meaning it is the forefront of progress, but not widely adopted. At the end of the day, it's lack of knowledge, and it's webinars like this that get people thinking about AI and automation in general. A significant challenge is public perception. Many people think of AI as depicted in movies like Terminator's Skynet, where AI takes over the world. This kind of fear influences public opinion and makes lawmakers apprehensive about approving guidelines without thorough consideration. It's crucial to bridge this knowledge gap and foster informed discussions to pave the way for responsible AI integration.
Kevin, what's your take?
Yeah, I agree. I think, put simply, people are just concerned about the risk of creating a monster we can't control. So it makes sense that people's leaders are trying to address that concern by implementing controls preemptively. As for their speed in implementing these controls, I can't really comment on whether they're being slow, as I don't have a sophisticated understanding of each government's list of priorities. But I will say that it is quite encouraging that governments are taking AI seriously from the get-go. People aren't having to do a lot of convincing that this is a big deal. So that's a pleasant change.
Definitely. And Pushpa, in the worlds of marketing communication specifically, how is this concept of regulation or control translated and played out?
Yeah, we kind of talked about like the macro level, and the micro level is at the company level. So company, when the FDA specifically has some guidelines, they always have some guidelines, but it's been very high level, and they've not addressed AI specifically as of now. So it is up to the companies to see what they want to do with it. It's all because of it's the data that they own, the content that they own, how they want to protect. But there is no overarching, because even for marketing communications, FDA took a very long time to come up with, for example, social media guidelines, and it's quite dated, right? So they're not updating it at the pace that technology is moving. That's where a lot of these things need to catch up, and they need resources as well, right? So they need smart people on the other side and then smart people on this side to figure this out. In my opinion, it is going to take much longer, because social media itself is something that we are figuring things out as companies and governments now. But just imagine how long AI really needs to in order to just understand and then make really policies that make sense for everybody.
That makes a lot of sense. Okay, so
I think like the regulation and control of AI in social media space is double folded, right? There are a lot of people, like billions of people on it, and then how data is actually like drawn back, and then also how it's communicated. It's kind of like a two-folded thing. So, but Alex, I would be interested to know, like, what kind of like the risk mitigation that you see, given again, there's technology part of it, communications, there are consumers, there are brands, all these put together. What's your take on like from the IT perspective?
Yeah, so to ensure, our AI systems are secure and compliant, we need to focus on several key measures. First, we should use advanced security techniques like AI-driven threat detection, data encryption, both at transit and at rest, and enforced strict access controls. For data management, it's essential to comply with regulations such as GDPR. This means we need to mask data management consent effectively and maintain thorough audit trails. Additionally, our AI models should be explainable, clearly documented their actions and decisions, clearly documenting their actions and decisions. Finally, staying updated on new and evolving AI regulations and ensuring our IT systems remain compliant is crucial for maintaining integrity and legality. And so now let's go over some best practices for building reliable and ethical AI systems. So first, make sure you're collecting high quality, relevant, and diverse data to avoid bias. Be aware of the AI model you choose. Public models like OpenAI's ChatGPT connect to the internet, which might not be suitable for sensitive data. A closed system could be a better option. Choosing the right algorithm for your problem is crucial as well. When training your model, use methods to make sure it performs well and doesn't overfit the data. Regularly check for biases in your models and strive for fairness to prevent discrimination. For validation and testing, use separate data sets to avoid overfitting and conduct rigorous testing to see how well your model performs. And finally, measure your model's performance with relevant metrics like accuracy, precision, recall, and F1 score to ensure it's effective. And then we can move on to discuss the National Institute of Standards and Technology, or NIST. So this entity provides the standards and guidelines around AI development. The key areas NIST focuses their AI research is risk management, bias and fairness, and AI security and policy. Risk management in the means of when you deploy a new AI, what potential risks do we face, like ethical, legal, or security risks? When we talk about bias and fairness, a good example is data bias. Is the data the AI was trained with not represented in the real world population, or contains historical bias? This can skew the outcomes. The big one that most lawmakers are going to talk about is AI security and privacy, setting the standards that say this is how you protect user data and ensure privacy. The 3 points NIST is focusing on are crucial to building trust and confidence in the public.
Excellent. So as we wrap up our discussion on risk here, we want to know, how important do you think it is for medical communicators to understand and utilize AI automation in their work? And so the possible responses are extremely important, somewhat, neutral, somewhat not important, or extremely not important. So we'll give folks a moment to get their responses in and get that submitted, and then we'll tally those responses. Okay, looks like responses are flowing in here. We'll give folks just another moment to submit those. And I see some are still flowing in. Oh, there's a clear winner here. So as of right now, it looks like 63% of responders feel it's extremely important, and another 25% feel it's somewhat important, and 13% are neutral. So I think y'all are still in the right place with us here today. So maybe the neutral folks, we can help you delve in a little bit more and understand some good potential use cases. And so with that, we're gonna flow right into talking about the value piece. So now that we've talked about the risk side of the equation, we have the flip side of the coin, value. So Alex, what do you see as kind of that defining moment at which AI actually has an impact for the person using it?
Yeah, so the 11 by 11 tipping point study in the slide, study conducted by Microsoft reveals that using AI tools for 11 minutes a day over the span of 11 weeks significantly helps users from lasting AI habits that enhance productivity and efficiency in the workplace. From my personal experience, I find a major time save in research. All we do in IT is deal with errors. Then when we fix that error, there's a second one to take its place. The amount of Googling and documentation I used to do caused me to lose valuable time. Now I can just take a screenshot or copy and paste errors, and then boom, I have all the answers I need. Naturally, the quality of answer does vary based on the complexity of the problem. But so now, question for the panel, would anyone like to share how AI has either saved you time or enhanced productivity? Kevin?
Sure. Well, I use AI literally all the time, in two different facets. The main way I use AI is in my AI development work. My team and I have trained AI to write 5 different types of medium-sized medical writing documents and portions of one large document. And we've completed 2 major pilot projects with actual effective documents using AI to write the first draft of those. It saved me personally at least over 20 hours total for those 2 projects. We might talk about those pilots as case studies during part 2 of this webinar in June. And then more casually, there is my work outside of AI development. I use ChatGPT to answer like sciencey questions in my medical writing work at least once a day, which over the span of maybe the last couple of years has probably saved me over like 10 hours of researching papers via Google. I don't have like a PhD or anything. I definitely have some imposter syndrome when it comes to medical writing and trying to understand documents really fast. So it's definitely helped me seem like an expert on some topics that I have no business calling myself an expert on. So yeah, I definitely use it all the time in my work.
I can shed some light too. As a technology vendor, MarketBeam being a technology vendor, we create efficiencies using AI. So there are two things, right? So one is the content itself, like the text that comes out of it, that's high risk, high volume. When it comes to communication content, it's been in the content itself has been increasing over a period of time. The amount of content we all consume on a daily basis has significantly increased, right? So over the last couple of years, every year it just increases, it doubles. Whether it's social media content or website or news or any other apps, the content is increasing. But so is the risk for, again, like a regulated industry like this, is it's very risky to put it out. So AI is helping not only create content, but it's also to check, actually, like, implement checks and balances. So the input for this is, like, of course, the content itself and the guidelines and then internal policies. All these things go in as an input. The output is spit out, just like, these are all the things that they need to fix because it's against the guidelines. Like, for example, what type of claims that we need to add, references that we need to add, though it is a social media post. So if there is a brand mention, then what else needs to go into it? So these kind of things would be the result of it. And then also, to an extent, what we're doing is, if there is a comment on a social media post, so that is free-form text coming from the consumers. That's consumer feedback. One is to understand consumer feedback in terms of, like, improving. It is just the drug feedback itself in many cases, and then side effects and things like that. Or sometimes it's adverse events. And then also to what to respond to them. That's also AI is helping. Again, it does not have to, like, create the original content, but it also helps with responding to a dynamic content. And then that's where the efficiency goes really, like, tenfold at this point. So we see in both efficiency in creating and then also in monitoring the content itself. So, but Kevin, to your point, you're in medical writing, right? So do you see, because of this AI, are there new doors opening? Right? What do you think? Like, new doors opening, opportunities, that's because that there is AI that's available to all of us today.
Oh yeah, for sure. Obviously, in the forefront of everyone's mind is just writing documents, medical writing documents. That's what a lot of us are here to hear about. But medical writing organizations do a lot more than just write documents. So I definitely think the number of doors there are is way more expansive than kind of that surface level understanding. So I want to, it might help to think about what we can do with AI as two different aspects of medical writing. First being the actual writing aspect, and then second being the business aspect, the running a department or running a firm aspect of medical writing. So talking about the writing aspect first, when you evaluate your medical writing processes, you have to identify all the procedures that require the most time or resources, procedures that are iterative, and then procedures that can be taught using a clear written logic. So what comes to my mind are the menial tasks like formatting, editorial correction, file organization, distribution emails like for reviews or QC or approval, query emails to your subject matter experts, decision logs, etc. Then I kind of move on to the more complicated tasks, thinking like management of stakeholder coordination, management of multi-document cohesion, content reuse, project health, lessons learned. Some of those things a lot of us don't have exposure to, but project management's become a big part of our work. And these are all those little classic pseudo medical writing work that divert our time and attention away from actual strategic medical or regulatory work, work that's actually reflective of our expertise. So things like developing study design or analyzing data or composing advanced interpretations of results, or devising regulatory strategy, that's our bread and butter. That's where we really want to focus our time. And that's what differentiates us as a department in a company or as an expert firm. So, do I like doing highly technical editing, administrating, project management sometimes? Sure. It's, mindless, easy task to help me kind of reset my brain once in a while. But is it the best use of my time when I know that AI could potentially be doing these tasks? Maybe not. Right. So, if we can utilize AI to perform or manage portions of those less strategic tasks, we can definitely see a big return on time and resources, allowing us the space to focus on that strategic work that makes medical writers special. So, yeah, definitely lots of doors.
Yeah. Jimmy, we talked a lot about like the business world, right? And like serving your clients or customers. But what do you think about like in-house? That's also like critical, right?
Yeah,
What do you
sure.
think?
So, whether you're running a department in a pharmaceutical organization, whether you're freelance like me, whether you're a consulting firm like Synterex, it's really important to evaluate your non-medical writing processes as well, because you might find that they're also requiring a lot of time and resources. If you're a consulting firm and you're finding yourself spending a lot of time generating requests for proposal documents, or you're finding yourself spending a lot of time reviewing time entry so that you can summarize your invoices, or you're writing a lot of applications for grants and certifications, this is all opportunity to have AI step in. And I see lots of applications for in-house as well. So, if you're going to have AI write medical writing documents for you, using this concept, why not also train AI to write these business documents as well, or perform these other tasks that you might have in your department?
Yeah, that's right. That's right. So, like beyond just the business documents, there is promotional documents, right? It could be documents or any kind of content. So, promotional content that needs to be optimized, and those need to be like even like created. It's not even like using AI, just even like the content need to be created. And as we are scaling content, AI can be utilized in other places too. So I can think of this example where our customers, they like, the data that's fed into that is all comments on social media. Feed that from the past whole 1 year, everybody that commented on a brand or on their like, corporate channels. And then what you can even like build. So this is kind of like opportunities beyond the usual document writings, right? So there is something called response guide. Like the response guide means how do you respond to any comments that come in, either on social media or it could even be emails. When somebody like puts out a complaint about a drug or any adverse events or like side effects, again, all these things. So today people use a lot of their own time, manual time, very like, to it, because there is AI available, it just looks inefficient. But before this, we used to do the same things, right? So handwritten responses to all these. So instead, we could just like go use AI, right? Even to come up with what is the response guide, canned responses, can we create all these things using AI with the input, the real-time data that we can pull from the internet, pull all these things, keep things ready, and just like, just shoot it out. Right. So that is another opportunity for medical writers to expand their opportunities into the world of creating these kind of like response guides, or like, keeping the dynamic content also handy and then ready for their clients and customers.
Excellent. So it sounds like a world of wonderful opportunities. So some of the procedures you both mentioned above involve more than just generating documents. So how would you use AI to tackle those procedures? Kevin?
Yeah, definitely. AI can do much more than just generate medical writing documents for us. Remember that AI can power the use of virtual robot assistants, which we've been seeing all over the place for many years, much earlier than ChatGPT has come on the scene. Um, and now MedAffairs is starting to use it a lot for MedInfo already. So definitely pharma has already seen a lot of practical application of bots. And you can also consider constructing dashboards or command centers to track and manage your work. The first thing that comes to my mind here is comment resolution and chasing subject matter experts for answers or decisions. This is a big part of my work, definitely what I spend maybe like the majority of my project management time on. Um, so just having some sort of centralized way to to get all of your answers in one spot and have some sort of virtual assistant help you do that. Um, I can see it saving me tons of time because, you know, on any single project, I might be sending like hundreds of emails, hundreds of messages. Back when we were in the office, you know, I'm talking like maybe 10 or 15 visits to people's cubes every day, which is fun, but it's not efficient. So that's just one of the examples that comes to my mind. Um, and other people might spend their time differently on different aspects of writing. Um, I don't know, Jeanette, in your day-to-day, how do you decide what you spend your time on, and what are you spending the most of your time on?
Yeah, great question. And by the way, I like that idea of a virtual assistant that can help me track people down and get their comments resolved. Sounds very appealing to me. Um, but I want to walk through with you guys one of the simplest models that you can kind of use to really find good use cases for AI. It's called the Eisenhower matrix, and there are a couple of variations on this, but the general idea is kind of categorizing your tasks by both importance and urgency. So I think in the day to day, one thing I would recommend is if you don't know currently what you spend your time on, like have the intern follow you around for a day and write down everything you do, because it will be really enlightening in terms of where you can actually add value and things that only you can do, and that will help you think through this better as well. But I think generally speaking, things that are less urgent but important. So that's that orange box. Um, Instead of delay, I might call that schedule. So, block off a time on your calendar to do it. I think we rarely get the chance to delay or delete in our space. But that orange box, as well as the urgent but less important, so that's the blue delegate box, are probably the ripest for picking in terms of things that AI could pretty easily tackle. They're going to be things that, if you had a junior employee, you'd be explaining the logic and the flow of how to do them to your employee or intern as well. So if you can explain it to them, you could certainly explain it to an AI, generally speaking. The less important and less urgent is probably an area that you could chip away at as well. Again, we don't really get the chance to delete. So I'd call those like the backlogged items or the back burner items. The key there is that you want to make sure you're picking things that are going to be high value to invest your time and resources in to use AI on. We're going to talk a little bit more about that in a minute. The urgent and important is probably a space where you could eventually chip away at that. Once you have some experience using your model and you're confident in your methodology and your prompts, you could essentially try it on that at a later point in time. But I don't recommend that green corner for kind of identifying initial potential use cases. So that's kind of what my approach would be.
Yeah, that looks like a good way to pilot it, right? I mean, it's all about what's the ROI? Yes, we are all excited about the technology. We're all excited about using it for personal use, business use. It's just in our lives for the past 18 months or so, and everybody's like billions of people are using it because it's free and then easy to use. But what do you mean? What is the ROI? And then how do we even like determine the ROI? It's not easy to even like, get to that, right? So your metrics gave a pretty good, like, which are those buckets? And then how do we put things? But Kevin, do you have details on like, what do you think? Like, how do you actually put those things into those buckets, right? You have any
Yeah,
tips that you can share?
yeah, I think, and I fully agree. Like, you'd have to think about the ROI for any decision you're making, whether you're running a business or you're running a department. And if you keep it simple and try to keep your metrics straightforward, um, it should be an easy answer or question to answer. So, before you embark on any AI development, you have to estimate how much that development's going to cost you and how much value you expect to come out of it. Um, so, for example, let's say you're considering automating portions of CSR narrative writing. And let's say your programmers are saying it would cost you 10,000 for a prototype CSR narrative generator. Now, if you're spending, let's say, $500 in man hours per week on CSR narrative headers alone, this might very well be worth the effort. But, however, if you're going to barely procure any work on narratives ever, then there's no sense in automating narrative writing at this moment. Plus, you also have to consider like calendar days, how many calendar days the AI development is going to take you. Even if it's really efficient, even if it's relatively low cost, and even if you might anticipate a return, if your programmers are estimating it'll take you half a year, and you can't be sure how much narrative work you'll have after half a year, that may also not be worth the investment. So, number one, identify the costs, identify the return, keep it simple. If you can't come up with these metrics, then maybe work on some other process that you can consider automating with AI.
Also kind of sounds like this would first require you to keep really solid metrics. You could kind of go back and reanalyze with your Eisenhower matrix and see what you're spending your time on after you try implementing AI. So Pushpa, what do you usually keep for metrics so you can evaluate these types of things?
We have built-in analytics. So again, it's like, twofold. One is the efficiency, right? So efficiency created in terms of, we even do like, for example, like, like a metrics, like the swim lanes, add this, like how many minutes you're spending on this today, and then how many minutes you're going to spend with the AI implementation to an extent of that with the efficiency. And there is the other one, which is like, in your face. This is the metrics that comes from social media or marketing campaigns themselves, right? So if AI is writing, and then if there is no personal touch, I mean, there is usually like a combination of that. It's not like AI is generating something and companies are publishing without reviewing, right? So, but with this combination, how is it reaching the audience? And then what would be their reaction to it? And then just capturing that as well, because we are scaling content with AI because of efficiencies. We can put more content out. So that also should result in reaching more audience and getting their feedback and capturing that. And it's kind of like a loop. So what the feedback that we got should also be part of the input for our next content creation. That's what I believe in. Like everything that we learn should go in as a lesson learned for our next cycle. That is super, super important. But with this, right, so automation has always been around, right? So automation is being used in different like contexts, because automation can be like so high that like, there's no manual interaction, or it could be at like, there's manual interaction and then automation. So are we replacing automation with AI? Because AI is even more hands-free compared to automation, right? So that's my question. Like, I don't know, one of you can answer this. What do you guys think?
Yeah, so it's 2024. Let's be a little lazy or just work smarter. They're kind of the same thing in the IT realm. For instance, when I was studying computer science, one of my professors told the class that the best developer is a lazy one. The one that could write the least amount of code to complete the task is always the best. It's time for leaders to push their employees to eliminate manual processes and focus on the work that really matters. I see AI replacing a lot of menial tasks that many professionals shouldn't be concerning themselves with. For instance, a number of the slides, including this one, I had AI create the image because I don't know how to use Photoshop, nor do I want to spend a couple hours figuring it out for one simple task. So, Jeanette, as a CEO, how do you see the role of leadership in encouraging and implementing automation to replace manual processes?
I really see it as essential, honestly. I mean, I think healthcare is a perfect example of a field in which the demand for workers is quickly going to outpace their actual availability. So we need to start giving people the tools to really focus on what they bring uniquely to the table, and the autonomy that comes with that. Yes, it needs to be done in a way that preserves patient safety, of course, but that seems doable with a lot of the things that we talked about today. And the other thing I would say is don't forget, automation has been used in medical communications for a long time now, for a couple of decades at least. I want to show you all one other thing as well. So in addition to everything that we talked about today, McKinsey recently put out a study that shows the impact of AI adoption on potential cash flow in businesses. So as you can see, the early adopters' cash flow is pretty much on a J curve. That's the one that's shooting straight up in the air. With those adopting later actually having a little dip and then coming back up, but frankly, they don't come up very much. And those who don't adopt at all falling very far behind in cash flow. And I don't know about anybody else, but personally, I would like more cash flow in my business. I'd like to optimize that. And in-house, I think that plays as well, because those are the types of things that contribute to pay raises, bonuses, among other things. Now, keep in mind, too, regulators never really came out with a stance on using automation in this space. So one thing I absolutely think we should not do is wait for permission from regulators to use AI the best ways we see fit. As I think policy will pretty much always lag behind the tech. Though, of course, we can disclose its use and certainly follow a lot of the best practices we talked about today. And so with that, I'm going to go ahead and open it up to Q&A. We're going to do one quick final poll after that, just gauging kind of what the content was today and if that was helpful. As a quick reminder, part 2 of our webinar will be on June 11th. And in that part, we're going to go through some specific use cases where we've used AI to actually tackle real world examples of things we came across in medical writing, not only from a writing perspective, but also a business perspective to save us time. So in the Q&A, Trinity, are you able to see if there are any questions for us ongoing in the Q&A? Looks like those may still be flowing in. So what we'll do is we'll go to the poll first. It looks like that has actually launched. And we want to know, now that we've talked about these topics, how likely are you to incorporate AI into your medical writing and communications business? Extremely likely, somewhat likely, neutral or unsure, somewhat unlikely, or extremely unlikely. So go ahead and select your answer and get those submitted. And it looks like those are still rolling in. And we've got some great responses here. We'll give folks another minute to put those in. All right, so it looks like with what we talked about today, about 86% of respondents are extremely likely to use AI in your medical writing or communications business or department, and 14% are somewhat likely. So those are great numbers. I'm really glad to see that this topic had an impact. And we'll check the Q&A one more time just to see if there's any ongoing discussion there or anything anybody would like to ask before we close today. Also, feel free if you have any anecdotes you'd like to share, we'd love to share those with the group on your use of AI in your business and department.
So Alex, I know you responded to my question. I did just want to maybe delve into a little deeper how this actually works. So let's say you've gone through the process, you've done your risk analysis, you've done an assessment of return, and you're ready to embark. What is the process? You engage a company that has AI. Do you need someone who's an expert on AI on your side? Like, what are the steps? How do you get started?
What, in just deploying your own AI system?
Yeah. How do you establish something to train? Is it interactive like ChatGPT, or is it a bunch of code? Because I work with you and I work with Jeanette basically in a vacuum. I don't see the back end. I just kind of help review outputs and give medical writing expertise, but I don't know, like, if I were running my own business, what am I supposed to be doing to start an AI system?
Yeah, I mean, you definitely need developers. I mean, there is a lot of code behind it. It's, feeding a it's feeding the AI a bunch of data to help it spit out your correct answers. It's just a lot of trial and error. All AI is basically doing is taking data and making assumptions on the questions it's been asked. And then you have to basically then go train it and say, this assumption is correct, this assumption is false. And so you definitely need a level of development expertise. You need developers, and then you also need, for instance, in your case, a medical writer, you need the medical writer to be able to say that assumption's correct.
Yeah, I think that's spot on. I think for me, it's about right people, right seats in this case. And what I mean by that is, once you've identified a potential use case for AI, you need to make sure that your company has thought about the governance piece of it, because I think that's really important to some of the facets that we talked about today in terms of how AI is overseen. So to my knowledge, there really is no model that's been put forth in our space for what a proper governance would look like. Maybe that's a paper for another day, but I think, it probably looks a lot like some of our other governance does in this space, whether that's a peer review committee, a clinical sub-team, something that has that cross-sectional input from data management and regulatory, and folks who are going to weigh in on, has this system essentially done what it was supposed to do? Really the same way we would do with any other systems that we put in place from a quality perspective. So I see that as kind of an essential component as well. Great question. All right. I don't believe we have any other questions in the Q&A.
I think I see another question from Gordon.
Great. Excellent. Seems that the capabilities of AI for video generation and personal assistance are leaping forward, but for regulatory and clinical medical writing, it's less clear. Why is this? That is a really great question. I think, for me, there's a couple of different problems that are represented there. And Kevin, I'll be interested to get your take too. But, one of the concerns that I've heard is around hallucinations. The model hasn't necessarily been trained on enough materials because there is this hesitation around the legal and compliance and IP implications of using AI. So the AI then goes and makes assumptions about what it knows, and it's in some cases pulling from information that isn't correct or just, kind of making stuff up. And I think people who have tried out these types of models have experienced that and have shared that type of feedback. So it's definitely something that causes hesitation, because what you wouldn't want to do is have something present, something in your safety profile that's the opposite of what it should be, or something that would be, catastrophic like that. But I think if you have governance in place, you're going to be catching things like that. So maybe that's a first step, is really thinking through that governance piece and making sure that we really have that in place. And I think, the other piece of it is around memory training and making sure that AI is remembering what it should. Kevin, do you have anything to add to that?
Yeah, I definitely agree that it has a lot to do with governance, and not just not just implementing systems, but like having to pitch the optimization of anything to your leaders is a big hurdle. And you're spending a lot of time making that risk assessment, making that value assessment, that you usually just don't have time to do, because, let's say you work on a project and you see 100 things you could do with the AI. When I finish a project, I barely have time to put together lessons learned with that team, because we're on to the next thing. And it's one fire drill after another. So one, you have to invest the time to actually evaluate your process. When I think about video generation and I think about personal assistants, I could rattle off like 100 different things that I would love to see in medical writing for regulatory and clinical writing. But you have to be able to pitch it. So like if I say, hey, I spend like, let's say 15 minutes a day asking my team formatting questions, because we all have different formatting techniques. And it takes like half an hour to go through each one, because we're doing screen shares, we're doing discussions, not everyone's available at the same time. I can already see value in having video generation just there, to have the AI show you like, hey, if you go to this part in your ribbon, you have this option, and this is how you can achieve this effect in a document. Personal assistance as well. Going back to like my comment resolution assistant idea, this is something that you can easily pitch the ROI on this to your team. It's just that no one understands that that's even a thing we do. Medical writers a lot of times get seen as just, editors, where you throw them a document and they handle it and then they give it back. That's not what we do. We're very interactive. We do a lot of project management. It's hard enough to convince our leaders that we're doing all this work. So to then try and convince them that, hey, let's cut down on all this work that we're doing and see if we can automate it, that's such a big hurdle. So I think that's a reason why it seems like the use cases are less clear for medical writing. At DIA Mask in March, I spent an entire section speaking on the other things we can do in medical writing outside of writing documents. So like, this being what, a 20, 30-year field, and your clinical department's not understanding what medical writers do as a hurdle, I think that's a big piece. I don't know, Jeanette, about how much time you would spend on non-writing portions of medical writing, but like I'm spending at least 50% of my time project managing.
At least I always kind of joke that, part of what I do is being the team psychologist and just kind of bringing the things and the people together. But, I think what we're getting at too is part of doing this might be going on the road show to different departments in your company and really explaining the value of some of these processes and pairing it up with the AI, and not just talking about the AI in isolation. Excellent. Wonderful questions. And with that, I think that's bringing us to the top of the hour. So thank you so much, everybody, for joining us today. And thank you to our co-hosts, Pushpa, and our guest speakers, Kevin and Alex. We're so happy to have had you join today, and we're looking forward to seeing everybody for part 2. Have a great day, everyone.
Thanks, everyone.
Thanks for having me.
Thank you.
Bye.